Signs and symptoms of heart failure and what to do. The heart is undeniably one of the most essential organs of your body. It acts as a blood pump and supplies all parts of your body with oxygen-rich blood and nutrients. But what happens when this vital organ fails to function correctly? Heart failure is a chronic health condition that slowly progresses, and the heart's muscles become unable to meet the body's need for oxygenated blood. Consequently, the heart is unable to keep up with its workload, and you experience debilitating signs and symptoms. Difficulty breathing or dyspnea is a common sign of heart failure. It usually occurs on exertion or while lying down. Dyspnea significantly lowers the functional capacity and health-related quality of life. In heart failure patients, dyspnea occurs due to pulmonary congestion. As the cardiac output decreases, the pressure rises in the pulmonary veins, making it difficult to breathe. Fatigue or weakness is also common in heart failure patients. Your body needs energy from oxygenated blood to perform everyday activities. Additionally, it requires energy to repair itself from the micro-trauma from usual tasks. In heart failure, the oxygen demands of your body are not met. It is unable to repair itself and gathers energy for optimal functioning. As a result, you feel more tired than usual and face weakness. Excessive swelling in the feet and ankles or fluid accumulation in the abdomen can be a sign of heart failure as well. Pumping abnormalities in heart failure can result in a backup of blood in the veins, causing swelling and edema in the feet and ankles. Additionally, due to prolonged elevated blood pressure in the hepatic veins and those draining in the peritoneum, heart failure patients may face fluid accumulation and bloating in the abdominal area, also known as ascites. Your heartbeat may vary slightly during a stressful or exciting event. However, if you feel like you have a noticeable irregular heartbeat, it may be a warning sign for cardiac failure. Patients with heart failure often experience fluttering heartbeat or palpitations. Some people report having a pounding or racing sensation in their chest. The rhythm of the beats may also be affected. The reason for irregular heartbeats is that the heart tries to compensate for its inadequacy to pump blood efficiently. Heart failure also causes coughs, which may be accompanied by blood-tinged phlegm. Due to abnormal functioning of the heart, the blood backs up in the veins of the lungs. This causes fluid to leak inside your lungs, causing pulmonary edema, and you start coughing it up. The fluid may be accompanied by small amounts of blood, giving the phlegm a frothy pink appearance. Frequent urination is common in heart failure. As the heart weakens, it leads to the buildup of excess fluid in the body. The kidneys struggle harder to rid the body of excess fluid, and therefore you have to urinate more than usual and in larger amounts. The symptoms of heart failure also include appetite loss and nauseous feelings. The abdominal bloating due to fluid accumulation may suppress your hunger, and you start feeling full earlier, even if you have eaten very little food. Other reasons for loss of appetite include a lack of adequate blood supply to your digestive system. Concentration and alertness problems can also occur in heart failure patients. Like other organs of your body, the brain also requires blood and oxygen to function correctly. Since it is the organ that controls focus, alertness, and concentration, a lack of oxygen alters its normal functioning, and you experience trouble understanding simple things. People with heart failure also suffer from immediate or long-term memory problems. In some cases, emotional responses may also be affected. Chest pain is amongst the most common symptoms of heart failure. It may occur due to a lack of oxygen supply to the heart muscle. Another possible cause of chest pain is pulmonary edema and inflammation. Sudden chest pain may be a sign of a heart attack, and it is a medical emergency. To diagnose heart failure, your doctor takes note of your symptoms as well as previous medical history. The presence of risk factors like high blood pressure, diabetes, or coronary artery disease can help with the diagnosis. A physical examination is also performed. Your doctor may listen to your lungs with a stethoscope to look for signs of congestion. The stethoscope also helps to detect abnormal heart sounds that may suggest heart failure. The veins in your neck, fluid accumulation in the legs, and abdominal bloating are also considered. After the physical exam, your doctor may perform a series of tests based on your signs and symptoms. Blood tests allow looking for particular types of heart diseases. Chest X-rays enable your doctor to see the condition of your lungs and heart. Your doctor may ask for an electrocardiogram to check the heart's electrical activity to determine heart rhythm problems. Doctors often perform stress tests as well. This test allows them to see how your heart responds to exertion. The results of these tests allow your doctor to develop a treatment program for your heart. Depending on your condition and symptoms, your doctor may prescribe a combination of medications. In some cases, doctors recommend surgical procedures to treat the underlying issues leading to heart failure. These surgeries may include CABG, valve replacements, or ventricular assist devices, depending on your problems. If nothing seems to work, you may require a heart transplant. Your doctor may recommend palliative care to ease your symptoms and improve your quality of life. Almost all cardiac patients are advised to adopt a healthier lifestyle. Besides easing symptoms, lifestyle changes may even prevent heart problems from occurring. Maintain a healthy weight, regular exercise, and a quality diet. These all play a significant role in maintaining your heart's health. Low-sodium diets, low cholesterol, and lean meats help maintain your health. Many studies have linked alcohol and smoking with increased cardiac issues. So, avoiding these habits is essential to avoid developing heart problems and easing the symptoms. Reducing stress also plays a massive role in keeping your heart healthy. Find ways to reduce stress, and don't forget to get proper sleep.